Good morning. Wonderful to be with you, and I really appreciate this opportunity to visit with you. I thank you first and foremost for your service in protecting our communities throughout the country. I've lived in Fairfax County since 1981 when I came here to go to law school at Georgetown, and so I have always appreciated, since raising my 3 children in Fairfax, my husband serving as a public school teacher. Thank you for your service in Fairfax and serving our community. I certainly appreciate that so much. If you look at the map where I represent Northern Virginia, which stretches kind of from where the CIA is in Tyson's Corner all the way out to the West Virginia border. So I have all of Loudoun County, parts of Fairfax. I have some of Prince William and Manassas, and then I go all the way out to Frederick County and Clark County for anyone who's out there. So it's a very interesting district. It's actually one of the few probably sort of very diverse swing districts for the whole area. And I have a tech corridor, I have federal employees, I have a defense industry, I have a booming healthcare and IT industry. I have more wineries than some of the California districts have. I have breweries, growing distilleries. Then I have dairy and cattle farms and all kinds of startup businesses and everything in between. So it really is a microcosm of the whole country. And one of the things we have, some of the best firefighters and first responders, I think, in the country. Just last week, I attended the Valor Awards for first responders in Fairfax County, where they recognized the extraordinary heroism of those who went above and beyond the call of duty. And we always have so many. I have another one in Loudoun County this week. Fairfax County is home to the much-storied Virginia Task Force 1. It's an elite group of firefighters and other trained personnel in technical rescue who really get the job done. And let's face it, when you've been hearing about all of the frustration. I was listening to the panel right before Senator McCain and the frustration of things not getting done and people being angry. But you guys get the job done. You understand there's a task before you and a problem to be solved, and these aren't red or blue issues. These are performing and being at a high level, and that's what makes it delightful to always work with you. 2 firefighters who were honored at the Virginia Task Force 1 were awarded the highest honor at the Valor Awards for a rescue that they had achieved in Nepal after the earthquake last year. And it was very exciting to go, not only to hear the stories of what went on in Nepal, but the morning when they came back, they had been there several weeks in Nepal, then they came back, and they were arriving very early in the morning on Saturday morning. So my local folks had called me and said, hey, if you want to be here, the families are all going to be here to welcome them back. And they were anxiously awaiting because, they hadn't heard, they had been in touch a little bit, but hadn't heard a lot from the families. So we were able to be out there at 6 or 7 a.m. in the morning to greet everybody. And it was just so exciting to see that community spirit, see the families, but also to know what a sacrifice it is for the families when you have to pick up and go and everything you're dealing with there. And so when those families arrived, when they got off the bus, the sheer joy, I don't think there was a dry eye in the place. And it was, those are the kind of things you wish the local reporters were there to see and report on and to really tell the story of everything that is going on there, because it was such a privilege to be there. So I can't thank you enough. So it's very easy for me to sponsor something like this. It's a GROTA bill for the 9/11 victims. I had worked at the Justice Department after 9/11, and so I was up in New York, and I saw, I was visiting there. I then would go back several times to visit the site, and I know when I went, and I came back for weeks, I had the black soot and everything, and you thought, what was in there? What went in there for everyone who was fighting that? You have no idea the kind of health impacts, even when you have all the protective gear. We know that firefighters have a higher risk of cancer. The studies have been there now. So I am so pleased that we were able to work out any of the complications there and get that passed and renewed last year. And I will continue to fight on that, because I think that is absolutely something that we owe our first responders for an incident like that, where they had no idea what they were going into. And it's, so, thank you. And actually, give yourself a hand for all you've done, not for us. That that just should go without saying that we do that. I've also, and that's why, for another reason, I'm going to sponsor HR 4625, the Firefighter Cancer Registry Act, because I think it's very important. I chair the Research and Technology Subcommittee, and one of the things that we really are focused on a lot is how we can gather data. We all, as Alex was talking about before, we all carry these around. These are our lifelines now. People have Fitbits. We have all of this health data that we can collect. So when you have a particular job that we know is subject to more cancer incidents, we need to gather that data. We need to make sure we are doing everything so that you have the best practices in place, that we can see perhaps that if somebody uses a certain kind of protective gear, that's better. Over time, you see that there's going to be better practices. So we need to make sure we have those best practices in place for you. And the way we can do it is by having a registry like this. And we know I was just visiting NIH last week, and we know when you can go in and do something like do the Firefighter Cancer Registry, that's not going to just help you. I mean, first and foremost, it'll be great that it'll help you. We'll get more information because you have the higher incidence. But that information can be shared and will be applicable in many cases to everybody else. So this is a good bill that sets out a good precedent to make sure we're doing everything to have your back on issues like that. Like I mentioned, the higher incidence, 14% more likely to get cancer than the general population. So definitely that's an area that we need to work on. And another bill that we passed in Congress, in the House, we still have to go through the Senate, so please share any thoughts you might have on this with your senators as you're visiting, is the 21st Century Cures bill. And again, that's not a red or a blue issue. I think a lot of these issues, really, when you're dealing with health, when you're dealing with fire and rescue and all these basic things that we know we need to have our state and local governments and federal government be involved in, we can have a lot of bipartisan support. And on the 21st Century Cures bill, we are going to reform what is going on at the FDA in approving new drugs and doing it sooner. The Cancer Registry will be something which can then inform the 21st Century Cures bill. We're putting more money into NIH for research and to find out how we, whether it's cancer, Alzheimer's, all of the chronic diseases that we know are costing huge amounts of money to our budget. Something like diabetes, which, every family has somebody with diabetes. I was in when I was up at NIH, they were putting me through the testing place where they do all the testing for the diabetic research that they're doing, and they had a people, I guess it was a bod pod that they call. So they put people in the bod pod, they figure out all the things that are going on there. So they have so many exciting things that are going on there. If we can cure diabetes in our lifetimes, which they said they can do, we are going to save billions and billions of dollars on our health care, not to mention being able to lengthen the quality of people's lives, not just that we are living older, but the quality of your life will be better, because Medicare and Medicaid, one of the biggest expenses is diabetes. If we can cure that by, again, getting more data, now people can hook up their insulin pumps to their iPhones, have that data coming in all the time. You may see moms and dads, they have have like an Apple Watch on that's tracking their kids' insulin, so they know when it's spiking or not spiking, and that's going to make such a big difference. That'll improve what you're dealing with, because when people don't have all the kind of emergencies, because they're able to, through their the information and technology we have, be able to better track chronic diseases like that. That's going to help. We had somebody testify before my committee who came up with an app to deal with epilepsy, because if you're suffering from epilepsy, you don't know when that next episode is going to come. But by using this app, it was sort of like when when a mom's hooked up to a monitor when you're in labor, and they can show you, they can see that contraction is coming, so you can prepare for the contraction. And for all you guys who've been in there, you know what that's like, right? So they do this with the epilepsy. It alerts them, an alarm goes off. So say if it's at night, the alarm goes off, somebody can come to them and they prepare for them to deal with that epileptic situation, and you don't have as many deaths because of that. So another great use of technology, and also something that will be helpful in our whole healthcare world. A couple other bills I wanted to tell you about. I could go on and on about the 21st century cures, but all of us have people with Alzheimer's, diabetes, epilepsy. We all know these chronic diseases we deal with, and there's so many exciting things that are going on right now in research and technology, which I think can improve all of our lives and extend the quality of our life. But I also wanted to mention a couple of the other bills that I have signed on to, a number of appropriations letters to fund the Assistance to Firefighters Grant Program and the Staffing for Adequate Fire and Emergency Response Grant Program. Again, and what I think is so important about those type of programs and where we can help is that money goes to your localities, and they then work with you. You're the experts. You know what you need in your region. You know what is the most valuable way to use this money and these grants. So and it's always helpful for us to hear back from you. If we have too many regulations on them and you aren't able to do what you know how to do because you're the experts. And how I like to operate is I like to listen to the experts who are working on these issues, and then if we can correct things where we've not, put in the right measures there or the right requirements or really not over-regulated it, please do let us know. H.R. 3591 is the Fire Sprinkler Incentive Act. I've also sponsored that. I was just visiting with some of my folks down in Manassas, in the Manassas area, and they had just, this was something that they go door to door to in some of their apartment buildings to alert people to these issues and to make sure they know about it. I'm going to be joining them in their door-to-door program. I thought when I ran for the State House, I knocked on 10,000 doors. I thought, what better way to, the sprinkler, systems are one issue, but then just fire safety in general. And what a wonderful way to have our local firefighters to go door to door, and they're helping people set up elderly who might not have the right situation and might have fire hazards in their home, and just to make that connection. So I look forward to doing that, and happy to do that with any of my folks and throughout the district. But that Fire Incentive Act will amend the IRS code to allow 100% write-off for the cost of automated fire sprinkler systems and retrofit property and accelerated depreciation. It's all the tax complication stuff, but you understand it. And then finally, an area that we've worked a lot on that no doubt you have seen some in your emergency response situations is the growing problem of heroin that we have in our area, and we've seen this in Northern Virginia. We have several task forces that have been set up that they're interdisciplinary. We are working with from the schools to the first responders, to our sheriff's office, to our federal, local, and state DEA and drug officials. It is a growing problem in our communities, and of course, we then see it in the emergency response area. So we do have some federal bills which are dealing with being able to use Narcan, use these things without you ever having to worry about any type of legal liability. The State House did pass legislation in Virginia. So in Virginia, I know you're protected, but we are now working on federal legislation so everyone's protected when you're dealing with that type of situation where you want to be able to give them one of those drugs to stop an overdose death without having any legal consequences. So I think that, one more I did want to mention is I've co-sponsored the Bipartisan Fallen Hero Scholarship Act, which would eliminate the family contribution used in determining Pell Grant eligibility for the children of firefighters and police officers who have died in the line of duty. So this is just one small way to make life a little easier for a child who, something we hope never happens, but if that does happen, to help them get with the Pell Grants and for college opportunities. We know this service area, when you have a firefighter in the family, this is a family sacrifice. I saw that so well when I was there greeting those firefighters coming back from Nepal and talking to the families about what they had gone through those several weeks when their loved ones were over there. Then, because during that they heard some stories about some very precarious situations, and they didn't know for quite a while whether their loved ones were okay. So we know what a family sacrifice this is. We appreciate all that you do, and thank you again. As said, our door is always open. I know one of the issues we also worked on was getting that Cadillac tax avoided, so we wouldn't have to be making you pay for your health care, additional fines or taxes on your health care plan. I would like to eliminate that. I guess we only have it temporarily put off. I think that should be eliminated altogether. Obviously, you have bargained. And I think I was on that very soon. But I think the important thing is first of all, you bargained for those agreements, so that's part of your package and what you bargained for. But more importantly, you have much higher risk and healthcare threats than the average person, so you do need to have that package. So that's what I think is the problem with the whole one-size-fits-all type of plan. It doesn't look at the situation that you're in where you have bargained for that. These are the healthcare needs that you have decided that it was good for what your family situations are, what your all of the healthcare issues you may have to deal with. So I look forward to continuing to work with you on all of these issues, and I know others that may come up, and so our door is always open. And thank you so much for the privilege of speaking with you today, and look forward to continuing that relationship and dialogue. Thank you. Thank you.